Allergodermatitis without atopy. For the dermatological exam steps, you need to have visual inspection, palpation, skin scraping, cytology, and then do a fungal or bacterial culture with histopathology. The etiology classifications are congenital, allergic, bacterial, fungal, normergic dermatitis, neoplastic, or an autoimmune, or endocrine disease, or ectoparasites. The allergic dermatitis are adverse food reactions, flea bite hypersensitivity, contact dermatitis, feline eosinophilic granuloma complex, or autoimmune disorders like pemphigus, discoid lupus erythematosus, or systemic lupus erythematosus. Adverse food reactions can have hypersensitivity types 1, 2, and 4. In dogs, the clinical signs are pruritus, seborrhea, which is oily scaling skin, and urticaria, which is pale red bumps. In cats, the clinical signs are pruritus, miliary dermatitis, and eosinophilic plaques. For the diagnosis, you need to have an elimination diet for 2 months and have IgE testing and intradermal testing. For flea bite hypersensitivity, it's hypersensitivity types 1 and 4. In dogs, the clinical signs are papular dermatitis, linctification, alopecia, and pyotraumatic dermatitis, and acral licking granulomas. For treatment, you need to have flea control, treat pruritus, and manage secondary infections with glucocorticoids and declined education. Contact dermatitis can have types allergic and irritant. Allergic types is type 4 hypersensitivity, for example, pollen or soap. Irritant contact dermatitis is direct skin damage from chemicals, for example, acids or detergents. For the treatment, you need to avoid the irritant and have bathing and topical glucocorticoid ointments. For feline eosinophilic granuloma complex, it can cause an indolent ulcer which leads to upper lip swelling, and an eosinophilic plaque, which is red and has alopecic swellings on the abdomen and thighs, and eosinophilic granulomas, which are nodular lesions on the tongue, mouth, and skin. And there is psychogenic alopecia treatment, which involves environmental enrichment, pheromones, and antidepressants, such as fluoxetine. For the autoimmune disorders, for pemphigus, pemphigus foliaceus is a pustular dermatitis which leads to hyperkeratosis, and pemphigus vulgaris leads to ulcerative lesions and systemic signs. In discoid lupus erythematosus, we can see alopecia, crusting, and erythema, and depigmentation on the nose, eyelids, and lips. And for systemic lupus erythematosus, for the diagnosis, if it's major, we can see Ana positive and Coombs positive anemia and thrombocytopenia. If it's minor, we can see fever and pleuritis. And the drugs for pruritus are oclancitinib, which is an anti-inflammatory and has rapid effect, or lokivetimab, which neutralizes IL-31 and you need monthly injections. And cyclosporin, it's an immunosuppressant for chronic cases, and you avoid in the case of neoplasia or toxoplasmosis.